I am a doctor in the emergency department at Viz. Today, let's talk again about which health checkups are actually unnecessary expenses. What checkups should men and women do, and what should you pay attention to before a checkup? Do you know? In this video, I'll discuss these topics with you. Every year, we have health checkups, and many people have this question. With so many checkup items, just like choosing questions on an exam, which ones should you pick? Some people might say, as long as it's listed on the checkup form or recommended by the checkup center, it must be useful, just select them all. But is that really the case? Actually, it's not. Next, I will tell you which items are actually unnecessary and are a waste of money. You should pay attention to them before you try them. Finally, I will use 4 tables to summarize what men and women should check for and what to pay attention to before the checkup. What about the following items? Regarding the checkup items, I suggest you pay attention to them. The first one is that it is not recommended to use x-rays instead of lung cancer screening. In many physical examinations, there are x-rays. The Physical Examination Center will recommend adding an x-ray, that is, a chest x-ray, to check for lung cancer. In reality, because the resolution of x-rays is relatively low, their detection rate is also quite low. Often, by the time lung cancer is found through an x-ray, it is already in the middle or late stages and quite large. The correct approach is to choose a chest spiral CT scan, that is, a chest CT toe, check and determine whether there is lung cancer. This is especially important for people over 50, middle-aged and elderly individuals, as well as those with a family history of lung cancer or who have been long-term smokers. They should have regular checkups. The second point is using CT and infrared too. As for checking whether there is breast cancer during women's physical examinations, routine breast examinations are a must. In many physical exams, it is recommended to use a chest CT as well as infrared screening to check for breast cancer. These are really unnecessary. So what is the correct approach? For early screening of breast issues, you can perform self-examination, use ultrasound or mammography to detect and assess any problems. If further examination is needed, breast MRI can be used as an alternative. The third point is using laboratory tests to check for stomach cancer. Some health checkup centers may recommend testing for stomach cancer markers, but in reality, these tests can't actually detect it. The correct approach is that gastroscopy is the gold standard for both screening and diagnosis. The fourth point is using PET-CT to screen for cancer. PET-CT scans can be considered one of the most advanced medical imaging technologies in the world today. However, the cost is extremely high, often exceeding 10,000 yuan. Therefore, in many cases, it's not very cost-effective and isn't suitable as a routine screening method. The correct approach is to choose low-dose CT for screening, but PET-CT is mainly used for patients who have already had cancer to further check for possible metastasis. The fifth point is using color ultrasound, that is B ultrasound, to check for prostate cancer. In fact, using B ultrasound to detect prostate cancer has a very low detection rate. So, what's the correct approach? You should choose the prostate-specific antigen test or PSA test to rule it out. Prostate cancer, especially in men over 50 and those with a family history of prostate cancer, should also be checked regularly. The sixth point is a common misconception among many parents, having their children's blood calcium levels tested. Some health checkup centers recommend that parents have their children's blood calcium tested, leading parents to mistakenly believe that if the blood calcium level is normal, their child is not calcium deficient. In fact, relying on this single test to determine whether a child is calcium deficient is inaccurate, and it is not recommended for parents to have their children undergo this test. The correct approach is to first observe whether the child has obvious symptoms of calcium deficiency, such as frequent sweating, irritability, or insufficient sleep. When it comes to lab tests, you should refer to blood calcium, blood phosphorus, and alkaline phosphatase together to make a comprehensive judgment rather than relying solely on blood calcium levels. Next, here are 4 charts, please. Save, share, and remind those around you. I'm VS. Follow me for more health knowledge every day. I hope everyone stays healthy and safe, far from any accidents.
TikTok.